Okay, so we're diving into some pretty intense territory today.
Hmm.
Your research paper on severe dengue fever,
Right.
particularly those cases that end up needing intensive care.
Yeah.
You've been looking at what happens when this mosquito-borne illness
Mm-hmm.
goes from bad to worse.
Yeah.
And I have to admit, even reading the title sent shivers down my spine.
Yeah. It's definitely a side of dengue that a lot of people don't realize is even exists.
Right.
I think most people think of dengue as just a bad fever.
Yeah.
And while that's true for some people,
Mm-hmm.
this research really highlights how it can become much more complicated than that.
For sure. So let's start with the basics then.
Okay.
Why is dengue such a global health concern?
Well, the reach of dengue is really quite staggering.
Yeah.
The World Health Organization estimates that almost half of the world's population is actually at risk of dengue infection,
Wow.
with a mind-blowing 390 million infections occurring each year.
390 million. That's more than the entire population of the United States.
It is.
Wow.
And those numbers are only expected to rise
Right.
as climate change creates more hospitable environments for the Aedes mosquito.
Which is the one that spreads dengue?
Yes, that's the one.
Yeah.
Projections suggest that the at-risk population could reach a staggering 6 billion by the year 2080.
6 billion people. That's almost the entire global population.
Yeah, it's a huge number.
And I know we hear a lot about climate change being a factor, but what does that look like on the ground when we're talking about dengue specifically?
So imagine this. You have rapid urbanization happening, especially in tropical regions.
Sure.
And this creates all these ideal breeding grounds for mosquitoes.
Oh, right. All those little pockets of water and stuff.
Exactly.
Yeah.
Now combine that with warmer temperatures
Mhm.
and changing rainfall patterns, and you've got a recipe for dengue to potentially explode in areas where it might not have been a major problem before.
Wow, that's a sobering thought. So it's not just about more mosquitoes, but also where they're spreading.
Exactly. And to add another layer of complexity to this,
Okay.
it's important to remember that there isn't just one type of dengue virus out there.
Oh, that's right. I remember reading about that.
Yeah.
There are 4 distinct types.
Right.
DENV 1 through 4, if I'm not mistaken.
You're spot on.
Okay.
And this is where it gets really interesting.
Okay.
And by interesting, I mean potentially dangerous. Having one type of dengue doesn't make you immune to the others.
Wait, really? I always thought once you had one type of a virus, you were in the clear, at least from that particular virus.
Yeah, that's a common misconception, unfortunately.
Okay.
And it doesn't hold true for dengue.
Mhm.
In fact, a previous infection can actually make a subsequent infection much worse.
Oh, no.
It's a phenomenon called antibody-dependent enhancement, or ADE.
ADE. That sounds ominous. What's happening there?
So think of it this way. Your body develops antibodies to fight off the first dengue serotype it encounters.
Okay, like a lock and key system.
Exactly.
Okay.
However, when a different serotype comes along,
Mm-hmm.
those existing antibodies can actually help the new virus infect your cells instead of fighting it off.
So instead of protecting you, your body is actually making it easier for the new dengue virus to take hold.
Yeah.
It's like your immune system is accidentally holding the door open for the more dangerous virus.
That's a great analogy.
Oh, good.
And this, as you'll read more about in the research,
Yeah.
is a crucial factor in why some people go on to develop severe dengue with all those life-threatening complications we'll discuss later.
Okay, so we've got these 4 different dengue serotypes.
Right.
And this ADE phenomenon that can really complicate things.
Yeah.
But let's get into the nitty-gritty now.
Okay.
What's actually happening inside the body when someone develops a severe case of dengue? Okay, so we've got these 4 different dengue serotypes.
Right.
And this ADE phenomenon that can really complicate things.
Yeah.
But let's get into the nitty-gritty now.
Okay.
What's actually happening inside the body when someone develops a severe case of dengue?
So the research paper you sent describes severe dengue progressing through 3 phases: febrile,
Okay.
critical,
Mm-hmm.
and recovery.
Okay.
The febrile phase is what we typically associate with dengue.
Right.
High fever, headaches,
Yeah.
those excruciating muscle and joint pains that dengue is famous for.
Yeah, it sounds absolutely miserable. Like
Yeah.
a really bad case of the flu almost.
That's a good way to put it.
Yeah.
And for many people, the illness doesn't progress beyond this stage.
Okay.
But for some, as they enter the critical phase,
Right.
things take a scary turn.
Oh.
This is when those warning signs,
Yeah.
like intense abdominal pain,
Mm-hmm.
persistent vomiting,
Oh, God.
or even bleeding, start to appear.
And that's where this vascular permeability syndrome comes into play, right?
Exactly.
Yeah, it sounds terrifying.
Yeah.
What is that?
It can be incredibly serious.
Okay.
Essentially, the dengue virus,
Mm-hmm.
along with this cascade of inflammatory molecules called cytokine,
Right.
can actually damage the walls of blood vessels,
Really?
making them leaky.
Leaky blood vessels. How does that even happen?
So it all comes back to this intense immune response we were talking about earlier.
Yeah.
The dengue virus triggers what's called a cytokine storm.
Okay.
Think of it like an out-of-control immune response.
Right. So I've heard that term before
Yeah,
in relation to like COVID-19. Is it a similar sort of thing?
it's a similar concept.
Okay.
In the case of dengue, though,
Yeah.
this cytokine storm, along with the virus itself,
Right.
disrupts the integrity of blood vessel walls,
Okay.
causing fluids to leak from the bloodstream into the surrounding tissues.
So almost like poking holes in a garden hose,
Yeah,
and then all the water, or in this case, blood plasma is leaking out.
exactly.
It's a domino effect.
And this leakage, this vascular permeability,
Right.
is what causes the drop in blood pressure and potentially leads to shock then.
Exactly.
Oh, wow.
And to make matters worse,
Okay.
one of the dengue virus's own proteins,
Okay.
the NS1 protein,
Mhm.
actually directly contributes to this vascular permeability.
So not only is the virus causing damage, but it's also producing a protein that makes the situation even worse.
Yes.
That's a double whammy. I'm starting to understand why severe dengue can be so dangerous.
Right.
Yeah, and we haven't even touched upon the impact on blood itself.
Yeah, you're
Dengue can also lead to thrombocytopenia,
right.
which is a low platelet count.
That's right. Platelets are what helps our blood clot.
Exactly.
So having a low count means an increased risk of bleeding, Raymay.
Precisely.
And the paper mentioned this happens for a couple of reasons.
Yes.
First, dengue can actually impact bone marrow,
That's right.
which is where platelets are made. But then it can also lead to the destruction of platelets that are already circulating in your bloodstream.
That's correct.
So it's attacking on two fronts.
Yeah.
And as if all of that weren't enough, severe dengue can even damage organs.
You're right. Organs like the liver,
Okay.
heart, kidneys, and lungs can all be affected.
Oh my gosh.
The liver in particular often shows signs of damage
Okay.
with elevated liver enzymes.
Right.
And this is often a key indicator for doctors that a dengue infection is becoming severe.
Wow, it sounds like one thing can lead to another, and before you know it, someone is in really bad shape. So with all these potential complications and cascading effects, early detection must be critical.
Absolutely. Recognizing those warning signs outlined in the research is key.
Right. And the research paper lists quite a few of them.
It does.
Severe abdominal pain, persistent vomiting, rapid breathing, bleeding from the gums or nose. It seems like a lot for doctors to keep track of.
Well, it does seem like a long list,
Yeah.
but it's important to remember that these warning signs are internationally recognized
Oh, wow.
by the World Health Organization,
Okay.
which really highlights just how crucial they are for that early intervention.
So the sooner doctors realize that a patient might be developing a severe case,
Right.
the sooner they can intervene and hopefully prevent things from getting even worse. So let's say someone is diagnosed with a severe case of dengue and they end up in intensive care.
Right.
Is there a cure at that point? Or is the focus more on just managing those serious complications?
So, unfortunately, there's no magic bullet for dengue.
Right.
No quick fix to make it disappear.
Okay.
Treatment in the ICU really centers around what we call supportive care,
Okay.
which basically means addressing the most life-threatening complications as they arise.
So it's about mitigating the damage as much as possible
Exactly.
and trying to support the body's own natural healing processes.
Yes, and a good example of this is rehydration,
Okay.
which is crucial because of all that fluid loss from leaky blood vessels.
Right. From the vascular permeability.
Exactly.
Right.
And doctors will also be closely monitoring vital signs
Of course.
like blood pressure, heart rate, looking for any signs of shock.
Okay.
And of course, they'll be working to manage the patient's pain and fever as well.
Yeah, absolutely. Now, what about thrombocytopenia, those low platelet counts that we talked about?
All right.
I imagine that transfusions are probably a pretty standard treatment in those cases.
You would think so,
Yeah.
but you've actually hit on a point of ongoing debate in the medical community.
Really?
Yeah, there's no clear consensus on whether to administer prophylactic platelet transfusions.
And prophylactic meaning given to try to prevent bleeding before it even happens.
Exactly.
Okay, but if someone is at risk of bleeding, it seems logical to transfuse, right?
You would think so, but research shows that these prophylactic transfusions don't always actually reduce the risk of serious bleeding in dengue patients.
Hmm.
And of course, like any medical procedure, Transfusions come with their own inherent risks as
Oh,
well.
yeah, for sure.
Things like allergic reactions or even transfusion-related lung injury.
Right, so it really becomes this risk-benefit analysis then for each individual patient.
Precisely. Now, if a patient is already experiencing significant bleeding,
Right.
then transfusions are absolutely
I was
crucial
going to say.
to replace the lost blood and help with clotting. But the decision to transfuse prophylactically
Right.
is always made on a case-by-case basis,
Okay.
carefully weighing those potential benefits against those potential risks.
It sounds like treating these complicated dengue cases requires a really delicate balancing act for these doctors.
It absolutely does.
Yeah.
And it becomes even more complex when you're treating certain populations.
Right, like pregnant women or the elderly.
Exactly. Or people with underlying conditions like diabetes or high blood pressure.
Yeah, the research paper mentioned those more vulnerable groups as well.
Yeah.
And really emphasized the need for specialized care in those cases.
And for good reason. These populations are at even higher risk of developing those more serious complications from dengue.
Oh.
So their treatment can be even more challenging.
So doctors really have to take this multifaceted approach, right?
Absolutely.
Considering not just the dengue infection itself, but also any pre-existing conditions or medications a patient might be taking.
Exactly. It's a complex puzzle.
It really is. So where do we go from here? What does the future hold for dengue treatment? Are there any promising vaccines or therapies on the horizon?
So there are actually two dengue vaccines available right now,
Oh, wow, okay.
PYD-TDV and TK003. But they aren't a perfect solution.
Oh, really?
Yeah, their effectiveness can actually vary.
In what way?
Well, depending on a person's history with dengue
Okay.
and the specific serotype involved in their current illness.
Oh, wow. So it's not as simple as just getting vaccinated and you're good to go.
Unfortunately not at this time.
Okay.
And there are also limitations regarding who should receive each vaccine.
Like what?
For instance, the CYD-TDV vaccine is actually only recommended for individuals who've already had a dengue infection.
Oh, wow. That seems a little counterintuitive, doesn't it?
It does make things a bit more complicated, but the good news is that scientists are constantly working on better solutions.
That's reassuring.
Yeah, research into new dengue vaccines and antiviral treatments is ongoing, and there's definitely hope that we'll have more effective and more broadly applicable ways to protect people from this disease in the near future.
Well, that is good news. We've covered a lot of ground in this deep dive into severe dengue.
We have.
From this antibody-dependent enhancement all the way to the complexities of managing those serious complications in the ICU.
It's a complex illness.
It's clear that this mosquito-borne illness is far more complex than many people realize.
It really is. And we've only just scratched the surface today.
For sure.
But hopefully this deep dive has given our listeners a much deeper understanding of this potentially devastating disease.
Absolutely. Particularly for those who develop those severe cases.
Exactly.
It certainly has for me. It's also been fascinating to learn about all the amazing research being done to find better ways to prevent and treat dengue in the future. So for our listeners out there, maybe this deep dive will inspire you to do a little further exploration of your own
That's a great idea.
into the world of dengue research. It's a complex issue,
It is.
but knowledge and awareness are absolutely crucial in the fight against this global health threat.
I completely agree.